Your experience is your experience. Okay? We're going to talk about ways that our partners can make it easier for us, but ultimately, we have to meet our own needs. It's our responsibility. Just as we're responsible for everyone, or we've made ourselves responsible for everyone, I should say, we need to meet our own needs. And that means spiritually. That's the first and most important thing. Because we are more spirit than we are anything else. If the Spirit of the living God dwells in us, we are more spirit than we are anything else. So we need to stay connected to Him so that we're able to do the things that we need to do. So we need to have a personal devotion, but not just personal devotion, but an intimacy with God. A personal relationship. I'm going to use a quote that the late Robert Cook once said, Dr. Cook. He was the king of King's College in Philadelphia. But he said, pray your way through the day. Before you answer the phone, pray. Before you open the mail, pray. Before you wash the clothes, pray. Before you help the children with their homework, pray. He said, pray your way through the day. Because if you don't, the enemy's going to take whatever advantage he can, because you're already so stressed out to tip the scale. He knows our triggers. He knows them, and he knows them very well. And so we too have to be responsible to know our triggers. So when we're really overly tired or whatever it may be, we've got to say, I need to decompress, right? And how are we going to do that? We are going to take time and separate ourselves to just be with God. Okay, so we can reset. Sometimes your computer gets frozen and we have to turn it off and reboot it. We have to reboot ourselves, okay? All right, so we see also that we have to take care of our emotional state. We have to make sure our emotional needs are met. Now, last night we heard a young lady share very candidly about what it felt like being single before. Well, she's married now, but what she felt like when she was single, you know, feeling this void, like something was missing and different things like that. We've got to take care of our emotional state, and it doesn't mean that our state of emotions are contingent upon someone else. Sometimes it's our responsibility to make sure that we are emotionally intact. And we're going to talk a little bit about how we're going to do that, okay? But we have to look at it biologically also. Because as we talked about this biofeedback, when you're having all of this stress, okay, there are all kinds of chemicals that are being released in your body, which we're going to talk about, and how those chemicals impact you. All right? So that's going to affect you biologically in terms of how your systems communicate one with another. All right? And then, of course, we have to have a psychological state. We have to have soundness of mind. You know, it's more of an awareness, a feeling, okay, a motivation in terms of when we say psychological state. We have to be aware of what's going on around us, okay? Then we look at the sociological parts of it. We have to have healthy social interactions, which means we need a healthy support system. We can't do it by ourselves. Pastor Bennett just spoke about the church being a community. It's something that is shared. Well, our lives also are very necessary in terms of healthy social interactions. You know, it's important to recognize when you are vulnerable, to withdraw yourself from people that can be negative or toxic. It's only bringing you down. You deal with those people. You don't shun them, but you deal with those people when you're spiritually fortified, because you need to bring something to them as opposed to them giving you something, okay? So that's really important too. But then lastly, we look environmentally, okay? We have to have a setting that's conducive to our well-being. So we need to be in a place where there's safety and security, okay? Without that, If you have a threat of possibly losing your job, okay, that's a sense, that affects your safety security, because now you're concerned about, oh, am I going to pay the mortgage? Am I going to be able to continue to, you know, pay for my home or my car or whatever responsibility that you have? So safety is important. Some people live, as Carla pointed out last night, in very, very dangerous homes where horrible things happen, okay, on a daily basis. So in that, if that person is robbed of that sense of safety, then they don't have well-being, which is what we talked about yesterday, right? Okay. So let's go to the next slide. So in keeping, no? Number 4. You're going to go back. Okay, you're right. Nope, sorry. Thank you. Okay, so in keeping with the concept of menopause and what a woman goes through, okay, it basically says a woman is born with a limited number of eggs. Those eggs are called ovum, which are stored in her ovaries. The ovaries produce hormones that regulate her menstrual cycle, which is estrogen and progesterone. And the pituitary produces FSH, follicle stimulating hormone. So this is the part of the life cycle. When that little girl on the first slide that we saw, when she hits puberty, that's when she begins to ovulate, okay? And then she will have her first menses. And that's telling us her body is changing, okay? But keyword here, hormones. And they're all coming from somewhere. So let's look at the next slide. Okay, so here we see that this is a picture of the female anatomy. And when we look at this picture of the female anatomy, I don't know if you're going to see it here, but I'm going to turn around. It's kind of hard because I want to get the mic, right? But I just want to kind of point out a couple things to you. All right, so forget my back. But here, if I can get my pointer to work, I'm not good at this. Okay, wait, sorry.
It's not going to show on the screen.
Oh, it's not going to show on the screen?
It's not going to show on the screen.
Oh, okay, well, sorry, I tried. I'll try to describe it. Okay, so on the loops where you see the fallopian tubes, and it says ovary, that little, sort of like a little bumpy white sac, those are where all the eggs are stored, okay? So all the eggs being stored there, the interesting thing is that that's all you're gonna have for your lifetime, okay? You don't get more, they don't replicate. Okay, so you're born with a certain number, and that's what you have, okay? So we talked about the ovaries producing this estrogen and this progesterone, and this is what prepares the cervix, as you'll see, even in pregnancy, it'll close up. Right now we see a little opening in the middle. That'll close up completely to protect the baby, to make sure that there's no issue with integrity. And that's why women would sometimes miscarry, because that cervix doesn't close properly, and different things will cause, trauma can cause, stress can cause them to miscarry. So what happens is, these are all hormonal changes. So that biofeedback that happens, one system is communicating with another, and it's registering how much estrogen is in my body, how much progesterone is in my body, and then subsequently, it responds accordingly. So let's just go to the next slide. Okay, we talked about the ovaries secreting hormones, But what you really need to understand is in the middle, the hypothalamus. Okay, make it smaller again. The hypothalamus, that little pink section, okay, that is the storer. It stores all of these various hormones, and there are so many more other than just estrogen and progesterone, and we're going to talk about those. But the hypothalamus stores them. The pituitary is considered to be the master gland in the brain. It's the master gland of the body. It controls the whole system. Okay? So if your pituitary, people who suffer like traumatic brain injuries, and they happen to be female or even male, it can cause various imbalances because that pituitary has now been damaged. Disease or tumors can also cause there to be all kinds of off balances. And it's important for us to be able to understand that when women are responding in ways that men don't understand, or even in ways in which women themselves sometimes don't understand, how many times have we said to ourselves, God, why did I say that? Why did I do that? I don't believe I did that, right? But all of these hormones in our body that we ourselves actually don't have control over, we have control over our responses, okay? If we're disciplined. But we don't have control over what's happening over something that we don't have control over. So your brain plays a tremendous role in how our bodies work, respond, and ultimately it will speak to what we're going to look at in a couple minutes. So let's look at the next slide. Keep it in mind about that hypothalamus because it's the secretor. It's a gland that doesn't get talked about a lot, but if your hypothalamus isn't working correctly, your pituitary can't. Because one secretes and the other one releases. So it has to have a balance, okay? That's why balance to our lives is so critical. But some of those other hormones that we're looking at is estrogen. Estrogen, it says estradiol, that's because if you go to a physician and you're having your levels checked, they're gonna look at it as estradiol in a laboratory. But that is estrogen, okay? And it changes in different phases of life. So we'll see that in the mid-cycle, which is the normal level, that's when a woman reaches from puberty, when she starts her first menses, okay? And she moves forward to probably, in most people's case, without there being extenuating circumstances, somewhere in her 40s or 50s, okay? It'll stay at that 500 range. Now we get to the late cycle, and we see it drop to 340 from that 500. And then we go to postmenopausal, which is now, we've gone through this whole life cycle. So we started where we were able to reproduce, okay? And then we get to this point where we can no longer reproduce. And so when we can no longer reproduce, that estrogen jumped all the way down to 18 from 1700, from 500. That's like a big jump, right? If you looked at it in terms of dollars, someone gave you $500 and then next day they gave you 18, you'd be like, wait a second, I worked for $500, you know? So it's a huge jump. And so in those hormones in women, not only is there estrogen, progesterone, but women also have testosterone, which is the male dominating hormone. But we too we're very much alike. We're gonna learn that today. We are so much alike. But anyway, so we have testosterone, and then we have that follicle stimulating hormone, FSH, which the hypothalamus will tell the pituitary to release so that a woman has a menstrual cycle. Okay, so there's this whole process of ovulation and what happens, and when the egg release, and if there's nothing there, that's when you will have a menstrual cycle. When the menstrual cycle is missing, either it's amenorrhea for some sort of medical condition, or you're pregnant, yay, right? So that's how that works. So let's look at the next slide. So let's talk a little bit about what is menopause, okay? So menopause is another natural stage of a woman's life, which I talked about earlier. It's where her reproductive years come to an end and her monthly period ends. Menopause is defined as the complete cessation of ovarian function due to aging, failure, or removal. Now, again, I said usually between 40 and 50. But, however, some conditions that affect your hypothalamus or your pituitary, okay, or your ovaries or something else can cause you to go into failure. And now suddenly you have amenorrhea, but you're 20 or you're 30 and the doctors are trying to figure out how to fix that, okay? Or if you have some condition where you may have to have your ovaries removed, a hysterectomy, whether partial or complete, and partial being that they can take a part of the uterus, just maybe the cervix, they can take the whole uterus, leave the ovaries intact, or a radical hysterectomy where they just take everything out, which was that initial slide that we looked at. If we go back and look at slide number 5. Okay, so that when you take away everything that you see there, that's a radical hysterectomy. And you see where the cervix is, that's a partial hysterectomy, and that's in women who might have had an abnormal pap smear and they don't want it to progress to full-blown cancer, so they will take, they do different possibilities. They can do a leaf biopsy where they take away just layers of skin, but it's for your gynecologist to determine to what extent you're at risk and subsequently choose whether it's a partial hysterectomy, complete hysterectomy, but that's what happens. So all of that's gone. So when all of that's gone, there's a whole issue. Because there was a communication going on between the hypothalamus, the pituitary, the ovaries, and now there's no uterus. What are we doing? There's no more ovaries. What's happening? So we'll talk about that. So let's go back to slide number 8, please. Okay, so we talked about that removal part, just so you can see that we're picking up where we left off. Let's go to slide number 9. So what causes menopause? It's a natural process of aging. It's where the ovaries shut down, okay? Women are born with a finite number, I mentioned that earlier, of eggs. Menopause occurs when those eggs are depleted, okay? Or if it's medically induced, as we just talked about for various reasons, or through medically induced if you have a surgical procedure, medically induced if you undergo chemotherapy or radiation. So as our bodies are insulted by different types of diseases, whether it's cancer or whatever it may be, it impacts how the whole system works. And then we talked about that surgically induced, which we just talked about. The last one that's on here that I didn't discuss is the thyroid gland. People don't realize that your thyroid, which sits right just above your collarbone, right behind, it looks almost like a little butterfly, but it has 2 lobes on it, and it produces T4. But your body cannot work without T4. The T4 is a critical element, so there are a lot of people walking around with hypothyroidism, which means that it's not putting out enough T4. So that now also will affect how a woman is able, or any person is able to function, okay? This is not specific to women. Any person that has hypothyroidism will have some difficulty in their ability to function, concentrate, problems with balancing temperature control, different things like that. So that can throw someone, if you have hypothyroidism, hyperthyroidism, any thyroid dysfunction can cause you to go into early menopause. So we can't just say, oh, you're only 30, you can't be going through this, or you're only this. The other thing is if the thyroid is surgically removed, because there are people who have goiters, they have reasons that, or thyroid cancer, it has to come out. So if that happens, that female is going to go into menopause so much earlier. So if the regular cycle is about 60, then she's going to probably hit it in her 40s if she gets it taken out in her 30s. It happens that quick, okay? So let's look at the next slide. So we want to talk about diagnosis. And the reason we want to talk about diagnosis is because a lot of the times we'll hear people say, oh, I think I'm going through menopause. Or someone will say to them, because they give some complaint, oh, I feel hot, oh, I feel cold, oh this, oh that. So they'll say, well, I'm going through menopause, but you want to know for sure. So what do? You go to your doctor and they just do this profile that you see here, okay? So they'll look at your follicle stimulating hormone, they'll look at the estradiol or the estrogen levels, your progesterone levels, prolactin. That's really important because, again, the pituitary speaks to the mammary glands when a woman is pregnant, just as she delivers, okay, to say, okay, now release that, that milk. What starts out as colostrum first, which is where all the antibodies are. And after about 3 days, then the milk actually comes in. My nurse will tell you that. So, that being said, prolactin is also a factor in determining our, what stage we're at, whether we're not in menopause at all, or we are in perimenopause, or menopause, or postmenopause. They do the same panel. And again, they look at the luteal hormone, which is, it causes an elevation of the luteinizing hormone, luteal. That's another name for it, luteinizing hormone. It causes ovulation. So we're talking about all this biofeedback that's happening between the hypothalamus, the pituitary. So I'm giving you all of this background for a reason. I know this is not a medical course, but I need you to understand what's happening and why it's happening so that when things happen, you do not default to, she's so miserable. Okay? I'm going somewhere with this, all right? So the other thing that you do is you look at the thyroid function panel, because again, we talked about that thyroid, okay? So we can look at the next slide. So we talk about stages of menopause. Perimenopause, menopause, postmenopause. And moving forward, so we look at the perimenopause. This is a stage that occurs between the ages of 40 and 50, okay? In a normal person that doesn't have any issues, hypothalamus, nothing, they're perfectly fine. So this perimenopausal stage starts somewhere between 40 and 50. And it can last for about 8 to 10 years. So that's before menopause ever happens, okay? So the average length of perimenopause is 4 years, but it can be as short as a few months in very fortunate women, okay? So it's not long-lived in some and long-lived in others. Perimenopause ends and menopause begins when a woman has not had her menstrual cycle for 12 months. So there has to be a complete cessation for a total of 12 months to actually signal and say you are no longer perimenopausal, you are in full-blown menopause, okay? So, because in the beginning what happens is you begin with irregularity. So you'll have it some months, you'll have it heavy, you'll have it this, it'll go away, you have spotting, all these other things happen. And then finally, it eventually just says bye. And when 12 months is gone, you're in menopause. Okay, so let's look at the next slide. So perimenopause, signs and symptoms. They are hot flashes, that women experience breast tenderness, fatigue, irregular periods, vaginal dryness, urinary urgency, difficulty sleeping, mood swings, night sweats, and worsening PMS, premenstrual syndrome. Now, there's a story in the States this was several years ago, where we heard a lot about PMS, premenstrual syndrome. And it was kind of new. So people were like, what? Women have had, the menses forever, from the beginning of time. What are you talking about, PMS? But because of those changes in those hormonal levels, this lady was actually in a terrible PMS episode, and she lost her cool and ran her husband over in the driveway with her car. Not funny at all. But guess what? She wasn't charged, because when they actually tested her, everything was off kilter. She was so far off in the numbers in terms of what normal values were that they said it was ruled an accident because she didn't have any control over it. So when your wife slams the door, say, okay, honey, because there's something going on here. It's more than that. And so I'm not advocating for anyone to go out and run their husband over with a car, or I'm not advocating that anyone has an excuse for poor behavior, okay? Not at all. But I'm just saying that sometimes when someone has inappropriate response, that sometimes that inappropriate response is not all because she's not altogether there, or she's miserable, or whatever the case may be. And then we as women, why I'm bringing this up, is because we in turn become really hard on ourselves. And we say, I can't believe I said that. I can't believe I did that. Oh God, I wonder what she's thinking now. You know what I mean? Because you said something to someone and you said it in the wrong tone. And now you're saying, oh, they must think that I'm such a meanie, or I'm such a crab, or this or that. Look, stuff happens, you go back and say, look, I was having a moment, I'm really sorry, and hopefully we'll be able to let each other just go on that and not hold it to heart, because a lot of the times it's stuff that's just more than they are able to really deal with, okay? I experienced it myself, ask Harold. Okay, so, okay, so let's go to the next slide. Okay, so menopause, what happened here? Okay, give me 1 second, I'm so sorry. Okay, so menopause occurs when that finite number of eggs the woman is born with, which we talked about earlier, are completely depleted. And we're talking about thousands of eggs. We're not talking about a few. Now, women will have maybe maximum 14 children. I mean, that's the most I've heard a woman to have. 19, somewhere around there. How many? What is the maximum births that a woman has? There was a story I was reading the other day in the US that this woman had 14 children. Natural births, not adopted or anything, 14. Does anyone knows that of a higher number? Yes. How many? 21. Oh, praise be to God. So you see, now you've got thousands. How many? 29. God bless you. Oh. Okay, not you. Well, God bless her. Okay? Wow, that's a tough one. But I can't imagine, when we talk about having a support system, she needed a huge support system with 29 children. But anyway, you do have thousands of eggs. In this case, we're going to use 29 as the maximum births out of those thousands of eggs. So where do the other eggs go? Okay? So those eggs, every time you go through your cycle, those eggs are released. If fertilization does not happen, then you have your menstrual cycle, and they are washed away, okay? So ultimately, once all those eggs are gone, thousands of them, we're done. There's nothing else that's gonna happen. So let's look at the next slide. So now that we're in menopause and we've moved from perimenopause to menopause, earlier you saw the signs and symptoms associated with perimenopause was maybe like a dozen, okay? Now this is full menopause. The list, I couldn't get them all on there. Some of them had to get squished because there's so many things that happens to our bodies when we are in menopause. So not only do we have irregular periods, skipping periods, periods heavier, lighter than usual, hot flashes, bladder irritability, bladder control, dry skin, eyes, mouth, all of those things become dry, emotional changes, irritability, sleeplessness or insomnia, night sweats or disturbed sleep, alteration in our libido. I'm going to stop there for a second because sometimes husbands and wives have a very active sexual life. And then the wife reaches this stage and she seems to not have as much of an interest. And you think that she doesn't like you anymore. It's not. It's hormonal, okay? And so her libido decreases. So we're going to talk about things that can kind of keep that integrity going, okay? That will help. Because if you don't know what you're working with, then you don't know how or what is available to you to help to balance those things out. But when it happens, it's a natural process, what is happening. And so you have a deterioration of your vision. So when women hit 40, okay, I'm a perfect witness for this, I never wore glasses, ever. And when I got 44, I had to wear glasses. I was like, wait, what happened? So the ophthalmologist says, well, you're over 40 now, Michelle. I was like, oh, you know, it happens. These things happen. So you have macular degeneration, so driving at night becomes a little harder for you. You get headaches. You get joint and muscle aches that come along. You have vaginal dryness, which causes discomfort during intercourse. There's feelings of dread or doom. How do you think if you had to walk around feeling this sense of dread or gloom, not even knowing why? You just feel it, but you don't know why. You know how unsettling that is? And then we can't talk to our husbands about it because you don't have a clue what we're talking about. I said, oh, I feel so sad. I don't know why I feel so sad. I feel like something terrible is going to happen. And I don't know what it is. And Harold looks at me and he goes, it's okay, honey. Well, that doesn't, I mean, he's sympathetic, but at the same token, he couldn't really identify with what's happening with me. And so, again, you have mood swings. That's why I said sometimes we will answer with the wrong tone or something, because that happens. We have difficulty concentrating, memory lapses, depression, skin eruptions. Your body is reversing itself, so when you're teenagers, you see they have acne, okay? And that's because all these hormones are in full swing. Now it's going the opposite direction, and you're saying, why am I getting acne? And I'm an older woman, but that happens too. Breast tenderness, weight gain, hair loss or thinning, that's the one we hate the most, and a racing heart, okay? So let's look at the next slide. Hot flashes. We're going to talk about relief of symptoms. So we're going to say, how do we help to mitigate the hot flashes that we sometimes will feel? So these are things for you to avoid. So you first have to identify your triggers, okay? So you have to know that, you want to look at, when do I have this most often? Is it morning, noontime, when I'm under a lot of stress? But some of the things here, stress, caffeine, alcohol, spicy foods, are known to trigger hot flashes. So you eliminate some of those things and you see if it gets better for you. Don't wear tight clothing. Try to stay in cool places. Heat is not your friend. Like, you know, see me sitting here sweating, you know, but I am actually postmenopausal. So I'm not having a hot flash, I'm just hot. But at the end of the day, these are things that you want to look at. Don't wear the tight clothing and don't smoke cigarettes, because smoking decreases the oxygenation in your blood. So if you have, if your blood is deoxygenized, then ultimately you're not carrying enough oxygen through, and it's just not working, that whole biofeedback system. So at the end of the day, you're going to get hotter. You want to keep the bedroom cool, and this is where you hear a lot of couples say, she says, turn on the fan. She says, open the window. She says, turn the fan off, close the window. You know, and it goes back and forth, but that's why that's happening. And for you younger women here, just this is good for you. A lot of women here are smiling because they're like, yeah, I know what you're saying. Yeah, I've been there, I'm having that now. But for the younger ones, it's really important for you to realize that it's not something to dread. It's a part of the cycle of life. And this is what God has how He has created our bodies. And so we embrace them at every stage of our life because it brings something else with it, okay? So don't let, you know, as we talk about this, you know, don't say, oh geez, it's the end. It's really not. Anyway, we'll continue to look at try to slow, when you're experiencing a hot flash, you want to try to decrease your breathing. Like, people think that if you are hot and you fan yourself, you're cooling down. You're making yourself hotter because you're creating an activity which is generating heat. So you want to slow everything down, concentrate and slow your breathing. Close your eyes, relax. Deep, slow breaths, and things start to calm themselves down. So we want to try to do that. Vitamin E supplements are known to also help, and you can try adding soy to your diet because we'll explain why in a little while, but soy also does help. So the next slide, when we're looking at relief of symptoms, insomnia or sleep disturbance, sometimes women will go to the doctor and say, I have difficulty sleeping. But the important thing is he'll say, okay, well try some Halcyon or some Ambien or some Valium or whatever they call it here, you know, and they have a different name, but it's a tranquilizer, something to help you to sleep, a sleep aid. You don't want to do that because what it's doing is further confusing your body cycle too. So you want to find natural sources to help you, whether it's chamomile tea or a warm glass of milk or a hot bath before you go to bed or whatever it is, and then just lay down. So try to stay away from the sleeping pills. Avoid caffeine because it's a stimulant. Alcohol at night. Keep your bedroom cool. Exercise daily. Exercise is good for so many things. We talked about that yesterday when we were talking about all of the different aspects of the holistic approach to health. Exercise daily, that will also help to alleviate some of these. I just mentioned the warm showers or having some hot cereal at bedtime. Now, for those people who may be lactose intolerant, okay, you either use something else, or if there's some reason that it's contraindicated for you to eat something at night, then skip that one and try the others. Because there's some medications you have to take on an empty stomach or whatever the case may be, and some people do it at night. So that may not work for you. Or it may not work for those people who are weight conscious and says, I can't eat at night, I'm gonna gain weight. Oh no. So that's also an issue. So let's look at the next one. So in looking at relief of symptoms and dealing with the mood swings, the fears, and the depression that we mentioned earlier, you have to, this is one of the things that will truly help you. You really have to spend time in personal devotion, more so than ever when you're going through all that you're going through. Because you have no control over what your body is doing. But when we go to our Father in prayer, He made this. He made this earthen vessel that I live in right now. So if whatever I'm experiencing, He has the ability to help me through it. Okay, so He helps me even in those moments when I'm feeling very moody to try to answer correctly or to not have my husband have a reason to say, oh, she's so miserable, you know, or whatever the case may be. So we have to spend time in prayer. Intimacy with God is going to help us through any and every stage of our lives. Okay, so that's the first and foremost. But you have to also find a self-calming skill to practice. When you are feeling, because we talked about earlier, knowing your triggers. You have to know your triggers. So mine is when I've got 50 things on my to-do list and 6 hours to do them. That's my trigger. That's going to make me short in my answers, ill-tempered, moody, answer inappropriately. I do that because I'm so stressed out, okay? So that happens. So you have to know how to calm yourself. So that may mean going back and taking 25 things off of that list, or just saying to yourself, well, whatever I get done today, I get done, and God willing, tomorrow's another day, I'll aim for the rest, and not work under that level of pressure any longer. So, you see in parentheses, it talks about guided imagery. Now, this is a part of our Western medicine, okay, that we use in terms of guided imagery. Now, I service patients that are not necessarily believers in God, but when I am dealing with someone that is either open to hearing or knowing about Jesus Christ, then I'll tell them about them, and I won't use the typical context of guided imagery, which is taking your mind and taking the setting that you're in and transforming it into a therapeutic environment, whether it's through smell, through white noise, which is, it's not music, it's sounds, but the sounds have a calming effect. So you create this little milieu for yourself, and sometimes you can't because life is so busy, so you only have the time you have in your car. So we would say, meditate. Pull out that verse that means so much to you, and say it over to yourself, over to yourself, over to yourself, or whatever verses help you in that process. But we too can utilize guided imagery as Christians because our Creator has created such splendor that when we visualize, we close our eyes and we visualize the magnificence of what He's created around us, it can only become us. If we open our eyes and we look, especially here on this island, at all the beautiful trees and the foliage and the croton and the Joseph's coat and all the other plants, it can bring the ocean, all of this beautiful sky. It can bring a calming effect to your body. So we can look at those things. Again, avoid tranquilizers, and you want to engage in purposeful activities. When you are experiencing fear, you're experiencing depression, and you're not really sure why that's happening, and you spend too much time thinking about it, it becomes a larger monster almost. So you have to distract yourself from that, detach from it. And in doing so, you want to give of yourself to others. And as you give to yourself to others, that fear, depression, it stays itself at bay. So we're in the right place because we're all a part of Christian service. And so as we serve each other, okay, and we serve our communities, all that helps. It actually helps to calm all of that and help it to go away. So let's go to the next slide. We're talking about, we said one of the symptoms that we have is when you're in menopause is painful intercourse. And that's because we talked about dry eyes, we talked about dry skin, but the woman's reproductive system also becomes very dry. And the peritoneal, which is the lining that separates between the cervix or the vaginal canal and the rectum, becomes rather thin as she gets older and goes through menopause. So in that dryness, your body's not producing the normal lubricants that it would. So you have to do, and that's why sometimes women will shy away. They don't want to talk about it. They don't want to say, oh gee, it's not pleasant for me. you know? So the conversation doesn't happen. The man doesn't know why she's shying away, but the conversation has to happen. That's why we're talking about this. We have to tell our partners what is happening and say this is what it is, and then you find alternatives. Here's one suggestion, which is KY natural with aloe. There's a regular KY, doesn't work quite as well. Some people experience burning with it, but you can figure out maybe what will work for you, but that's just a suggestion. And that will help to bring that intimacy back into the relationship because it will alleviate the discomfort that comes with during that period of menopause. And this does not happen to all women. Not all women at all. Some women go through menopause and never have a hot flash, never have anything. We say they are blessed. You know, we are all blessed, but they're fortunate. They just don't seem to have anything happen. They don't even know. So the next slide that we're going to look at is slide number 20. Okay. I'm looking at the one that says hormone replacement, HRT. No, go back. Go back. Okay, thank you. I'm sorry, I messed you up. I apologize. So the hormone replacement therapy, for women who are going through menopause and you go to the doctor, they will oftentimes say, oh, well, let's just give you something to help you. And they will put women that are in menopause on birth control pills because it actually acts as, it mimics what the body would normally have, so you don't go through the effects. So they'll put you on a low estrogen, low progesterone birth control pill to help you. Or they'll give you a prescription drug such as Premarin or Prempro, or they will even give some women testosterone. And that's all going to be based on that profile that we looked at when we looked at the follicle-stimulating hormone, luteinizing hormone, and all those things when they do your blood test. But you have to know that if you do this, if you take this route, this conventional route, then there are some risks that are associated with doing so. And so that I give with a little warning, and I'll tell you what those are shortly. But so the next slide is hormone replacement therapy. We're going to look at the risk and benefits of that. So that would be the next slide. Okay, so the risk of taking hormone replacement therapy is it puts you at a greater, an increased risk for coronary artery disease, which we spent a lot of time talking about yesterday. So you will end up with angina, which is nothing more than chest pain, atherosclerosis, we talked about that, hardening of the arteries, blood clots, stroke, breast cancer, and diabetes. So you're taking this to help to alleviate those symptoms, but now you're predisposing yourself to these other things. So those are the risks that are associated with conventional treatments to try to mitigate this issues with hot flashes and all the other things that come along with it. But the benefits, can't just say that they're the risk. There are also benefits in the hormone replacement therapy, which is it helps to increase your bone density, and it will, they believe that it will also help to increase the blood flow to your heart, but there's a question mark on that. So let's look at the next one, which is relief of symptoms. So I said that was the conventional way. This is a more naturalistic way of, or homeopathic way of addressing these same symptoms. So we're talking about botanicals. These are medicines that come from plants that are found in the foundation of more than half of the drugs that we actually take. So if they're making drugs with these same plants and giving them to us, why don't we just use the plants, right? So let's look at the next slide, which is relief of symptoms. Okay, so we're looking at slide 23. Okay, well, I'll just continue. When we talk about the relief of symptoms, we're talking about phytoestrogens. You see this slide that says phytoestrogens on there? Phytoestrogens are estrogen that comes from a plant base, okay? So that's what you call bioidentical, okay? When they give us Premarin or any of the other medicinal treatments for menopause symptoms, what's happening actually is they're not bioidentical. They don't bind to the proteins in our body. But when we use phytoestrogens, they actually bind with us. So let's look at the next slide that says found in plant-based foods, which are isoflavones. Okay, so we see an estrogenic activity that happens when we eat various foods, such as yams. We have Mexican wild yams, which is excellent. I mean, it comes in a powder form, a capsule, or whatever, but yams have a huge amount of phytoestrogens in them that help to balance our bodies for what our bodies are no longer producing. Soybeans also have that, and they're also whole grains. So, I don't know, our slides are not matching. Thank you. Botanicals benefits. We're talking about it will help to decrease your hot flashes, your night sweats. It'll decrease and eliminate vaginal dryness. So we talked about the KY jelly, but here it is. If you put the phytoestrogens in your body through the foods that you're eating, you start to bring back this balance, this equilibrium comes back into play. And so you are minimizing the effects. It lowers your cholesterol, which is something that we talked about, putting you at risk for heart disease. So now that's off the table. So sources of phytoestrogens, for one, it's an herb, which is, you can probably find it in any health food store. Well, you can in the States. I don't know if they, I've seen a few health food stores in the mall, Sheridan Mall and so on. But it's a loose herb called black cohosh. Okay, and you can also use flaxseed or linseed. That also will decrease your risk for breast cancer. Primrose oil will help with the breast tenderness. So we could list a whole plethora of things that happen, but here are a lot of things that can actually help you to feel so much better. So the next slide, 24, relief of symptoms, okay? There's another, when we were talking about bioidentical hormonal therapy, it's made from soy. The Sotopele is a brand. This is something that is used in the United States. Now, just to give you an idea of the extent of how good the phytoestrogens are, Sotopele is a phytoestrogen because it is made from Mexican wild yams. It's about the size of a rice grain, and they insert it, okay, into the buttock, right just under the skin. So it's just below the dermis. And so what happens is it sits there, the body absorbs what it needs, it eliminates all the signs and symptoms, all the joint pain goes away, aches goes away, everything goes away. But guess what? You have to do it at least in the beginning 3 times, and then it's once every 6 months for the average woman, okay? But it's only $1,800 a pellet, and your insurance doesn't cover it. So that again puts us in a situation of the haves and the have-nots, because what do you do when you can't get that little Sotopele? Yes, get the Mexican wild yams, they're pretty cheap. And so, or we use some of the other things that we said, plant-based foods, okay, will really make a huge difference for us. Soy has a lot of benefit, and again, yesterday I mentioned about non-GMO. That's your preference to choose or not to choose, but soy is helpful in that regard. I say non-GMO soy. But in using these phytoestrogens, I want you to know what you're giving up. If you use what the doctor gives you, that conventional treatment is actually generated from the urine of horses. So Premarin, all these other, because we're talking about bioidentical. There's nothing identical about a woman's body and a horse. And yet and still, you're taking the urine, you get these mares, you impregnate them, you put them in stalls, you do terrible things to the animal so that you can harvest, okay? And ultimately, make this medication that comes from horse pee. I'm sorry, that's what it is. And so ultimately, when you think about that, you don't want Premarin or estrace because they're all made from the same source. So we want to try to avoid that, and let's just stay to the natural course. That will help you much more. The next slide. Okay, so we're talking about the effects of menopause and what does it put you at risk for. So when you're going through menopause, because you don't have that estrogen at the same level that you once had, what happens is you lose some of your bone density. Now, yesterday we talked about things that were more predisposed to Africans than to Caucasians. Osteoporosis is more found in Caucasians than it is in Africans. We have incredible bone density. So even though this says you lose 25%, most African women do not develop osteoporosis to the point that they need any kind of treatment or anything like that, where our Caucasian counterparts do. The lighter they are, the redheads, they just go right in the toilet. Their bones become so brittle. They suffer all kinds of fractures just spontaneously because of this, okay, and not having the hormone replacement. But then you are also at risk for colon cancer because, again, all of these hormones play a role, and now that they're missing, they're putting you at risk for certain things, which is why we're saying put the phytoestrogens in, try to balance everything out so that you decrease your risk for heart disease, stroke, bladder prolapse. And I'm going to stop there for a second. On bladder prolapse, we'll find, like we talked about, women have urinary frequency or they have an urgency. So what happens is because the tissue is starting to lose its moisture, it's drying a bit, what happens is the bladder kind of folds in on itself. But we can help to fix that. Kegel exercises, does anyone know what a Kegel exercise is? Okay, all right, so Kegel exercises, they teach you this during, if you go to a early, let's say, I'm losing my thought, I'm sorry. But when you're pregnant, you go through, Lamaze classes. So you go through Lamaze classes, and during the Lamaze classes, what they do is they teach you how to help to strengthen the floor of the uterus so that when it comes time to push, you're able to really push that baby out. So it tells you that you're not moving anything, but you're literally lifting your uterus inside of you. You can feel it. I'm doing it right now. You know, you can feel it. And you do the Kegel exercises. We can talk about it in private, girls. And that will help you with that bladder prolapse as we strengthen the walls, okay? So other conditions that we have are effects on the pelvic organs, and I just talked about that. So we can go to the next slide. So in preventing osteoporosis, even though we're not at a great risk for it, is calcium supplements with vitamin D3. Your dosage is varied, and I want to stop here for a second. Vitamin D3, or D-hydroxy-25, which is what its chemical name is something that is very, it's almost an epidemic in the United States where people are insufficient or deficient in vitamin D. Our bodies get vitamin D through the sun. The younger you are, the more readily your body absorbs vitamin D. However, even though as we get older, we get less and less ability to absorb it from the sun. However, because you live on the island, you think that I'm in the sun all the time. But that may not be true for everyone, because a lot of people spend a lot of time in their cars, they spend a lot of time behind the desk, they're not getting outside. So one of the things you do want to do is when you go for your physical or whatever, you ask your doctor to order a D hydroxy 25 to determine what your vitamin D level is. Because if your D level is low, nothing in your body will work right. I said that, I'll say it again. If your D is super low, insufficient, or deficient, nothing in your body will work right. They're just doing so much research and finding that D3 is so critical to every system in the body. There's a particular cardiologist at Johns Hopkins University, and he's a cardiothoracic surgeon. He actually, before he will operate on a patient to do any sort of heart procedure, open heart procedure, he will turn and put them on high doses, very high doses, 10 days before the surgery. And then he will also use very high doses of D3 for 14 days after the surgery. And he says they recover 25% faster than patients that don't get it. So it's amazing, right? So there's more and more literature coming out about D3. So that's something you want to do. If you happen to be, this is just a sidebar, if you happen to be, there's an issue of deficient, which means your body just doesn't have enough at all. And then there's another level of insufficient. You have it, but just not enough for it to work. So that will determine the amount of D that you are required to take. That's something that's personal between you and your doctor. If he says, oh, don't worry about it, like a lot of doctors do your own research, okay? But I will say this, that anything less than 5,000 international units a day will do nothing for you if you are insufficient, and it will do absolutely nothing for you if you are deficient, okay? So deficient people get put on 50,000 units a day for once a week, just to boost them up. So as you see here, you have all of these other things that help to prevent osteoporosis. I'm not going to go through all of them. I'm sure you had a chance to look at the slide, but green leafy vegetables are really, really, really important. And again, exercise, because weight-bearing exercises will help you to strengthen your bones. So the next slide, when we talk about preventing heart disease and stroke, we want to, next slide. We want to talk about monitoring your salt intake, and there's a reason for all of that, because as we get older, we develop that whole joint pain and swelling and things like that, and salt will help to contribute to our body's water retention. So you want to control your high blood pressure, control diabetes, you want to have your regular medical evaluations, because menopause puts you at risk for heart disease and stroke. You want to be able to monitor the things that you see before you, low-fat diet, so on. We talked about good fats yesterday. So we're not talking about eliminating fat, we're talking about putting in good fats. But you also want to have your annual EKG and a possible echocardiogram, and that's up to your doctor to decide, just to see how your heart is working. Yesterday we talked about getting a baseline so that you have a comparison. Now you see, now that you're in menopause, you need that baseline to kind of see if everything's okay with that heart or not. So the next slide talks about preventative measures for colon cancer. And so you want to eat a high fiber diet, you want to drink water, which we talked about yesterday because we're 70% water. You want to exercise regularly, 3 to 4 times a week for 30 minutes or 5 optimally. And you want to obtain an appropriate body weight for you. You want to have a colonoscopy, okay, starting at age 50, unless, of course, you have a family history of colon cancer, in which case you would want to do it a lot earlier, maybe even in your 30s or 40s, okay? So we're going to go to the next slide. So it says postmenopause, a time after menopause. This stage is marked by the cessation of menstruation for a full year, inability to conceive, decreased or no more noticeable signs and symptoms, all the hot flashes, night sweats, mood swings, and all of those things are gone. That's the next stage, okay? So you get to, that's when you were in menopause, now you are at the point of postmenopause. All of those things go by. So let's go to the next slide. So for you, we're going to talk about recommendations. So it's important for women at any age to do monthly self-breast exams, okay? And it can even be fun. You can teach your husband how to do them. And or you do them yourself or he does them. But whoever does it consistently either before your menses or after your menses, because there are so many different hormonal changes that the breast changes. They're very cystic, and so they're fibrous. So what happens is you will feel something different at a different time of the month. So if you do it the same time of the month, or pick a day and say this is the day I do it, you will notice that there's any subtle changes in your breast. So that's a very important thing. You want to do an annual mammogram, and you want to do your annual GYN gynecological exam, pap smear, and the blood work that your doctor feels is appropriate for you. For nutrition, you want to take the phytoestrogens as we talked about. You need to exercise, you need quiet time, that downtime that we talked about earlier. You need your personal devotion, your intimacy with God, and you need a strong support system. You need emotional stability, which is so important for us, and we need a sense of love and belonging. That's one of the things that they touched on last night at the Church of Singles were talking about, not feeling like a sense of you belong when people leave the church. Well, it's not just in singles, it's in people. This is something that's universal for all of us. We all need to be loved and we all need to belong. And so having a supportive system, having a supportive husband, family, friends, helps us in that process. And ultimately, you want to definitely do a colonoscopy. So now we're going to move on to, we did a lot about women, but we're going to go to the next slide. We're going to talk a little bit about men here. And so we talk about menopause all of the time. Can you advance the slide? Okay, so we talk about women all the time, but men go through andropause, which is a form of menopause. Ha-ha, guys! You're in there. You're in there. So you have andropause. And so it changes in the function of the testes, and it occurs around 45 to 50 years of age. And it's more extensive after you become 70 years old. You have a decline in your testosterone levels, and you get symptoms of fatigue, weakness, depression, and you too have sexual problems. Okay, so testosterone in men actually transforms into estrogen with low levels of testosterone. I'm sorry, that happens in women. And then in men, what happens is your testosterone decreases, you lose muscle mass. So what happens when men are young, they have this, they can lift weights and get really, really buffed. And then subsequently, they get older and they lose that buff look to them. But the great thing about men is they don't lose strength. Their strength always stays, unless of course they have some sort of physical disability that makes them weak. But strength they have. So the next slide talks about your prostate health. During this andropause, you also are at risk for prostate problems, which is, the prostate is a part of the man's sex organ. It's about the size of a walnut, and it surrounds the urethra. So the next slide shows us exactly where it is. On the right, the brown that looks like the yarn is actually the bladder that sits behind it. And the little white cone that's around that looks like that little walnut, that's almost hugging, because I don't have a laser pointer, that little white part, that's the prostate. So what happens is when it gets larger, it will squeeze the urethra. That red line that's coming down the middle, that's the urethra. That's where the urinary stream flows through. So ultimately, I'm told I have to wrap this up, but that is part of your anatomy. So the prostate gland produces components of semen or fluid that helps to support and transport semen. Next slide. And the next slide. Yeah, so some of the conditions that men can have with their prostate is prostatitis, which is inflammation of the prostate. Then you have benign prostatic hypertrophy or hyperplasia, which is BPH, an enlarged prostate, and then ultimately prostate cancer. So who's at risk for all of this? Next slide. All men are at risk for developing prostate cancer. Race, age, and family history play no role at all. So the next slide talks about the statistics. Men over 50 are the most common, it's the most common problem is prostate enlargement. African American men 40 or older have a greater risk for prostate disease. There's 1 in 6 men who will be diagnosed with prostate cancer during his lifetime, and 80% of men who reach 80 years old will develop prostate cancer. So let's go to the next slide, which talks about signs and symptoms of benign prostatic hypertrophy, which is the enlargement. And this is where women can help men and men can help women. It starts by maybe having a difficulty urinary stream, sometimes hard in initiating, or you have an urgency that you have to go to the bathroom immediately. Or sometimes while you're urinating, you'll have an interruption in your urinary stream. There will be an increased frequency with very small amounts that are produced of urine. So then you have the urge to urinate after you've already gone to the bathroom. That's another sign of symptom. Bathroom trips several times per night is also a red flag. A weak urine stream, leaking or dribbling urine, or small amounts of blood in the urine. Any of those things that happen, or that your husband tells you, or you notice him getting up often enough, or having to go to the bathroom regularly, those are all issues. And the last slide, as we wrap this up, are the recommendations for men. Again, they want to have an annual physical and prostate exam. They want to do annual blood tests, but it must include a PSA, a prostate-specific antigen. That will tell you whether or not you have prostate health. And ultimately, you want to identify unusual symptoms and consult your doctor or treating physician. African Americans and men with a family history of prostate disease should start screening at about age 40. Other categories should really start about 50. That's the screening for your PSA. And that concludes our presentation on men and women and what our bodies go through in its life cycle.
Excellence with which you handle these matters. You ought to be proud that that is your way. A lot of times there is a question from men about the testosterone replacement, and because a lot of things change when the testosterone becomes low at a certain age. Talk to us, please. What is your view on that, the replacement, and what are some of the safe ways? For instance, there is a product called Zima, zinc, magnesium aspartate, which was recommended to me like about 10, maybe about 18 years old actually, for weight training. And there are other things that are on the market that are being produced, presented as options for men. Eugenics is the new. Yes, that's.
We talked about that yesterday, eugenics.
No, not eugenics.
Oh.
It's one of those new testosterone boosters that is on the market now.
Okay.
I think it's NUGENI. Yes, eugenics. N-U-G-E-N-I-X.
Okay.
Do you know anything about it?
No, I don't know about eugenics specifically, but what I will say is that the safest thing that we can do, and this is for men and women, because we also have testosterone in us. And so sometimes when our libido is a little low and we visit the doctor, they may give us a boost of testosterone to help to boost that, okay? But taking the products that are on the market, it's like any other supplement that you're gonna take. You're taking it at your own discretion, and you're gonna basically see how it works for you, okay? Like if you find any specific benefit from it. But I would recommend more seeing your primary care doctor, your internist, or whatever, whoever you see, your GP, and having them actually test your levels, okay? Because then that will give you a clearer picture of where you are as an individual. And then they can give you testosterone replacements that doesn't come from horse's urine or anything like that. They treat men better than women. So you can get that in your doctor and you can work it out, or they can give you different supplements as well. But for the most part, yes, testosterone replacement sometimes is required for a man's health, not just because of his libido or it just helps with his overall health, muscle health, the whole nine. So
my concern is not deficiency.
Okay.
My concern is maintenance. So for instance, for men, we start losing muscle mass after 30.
Yes, you lose that. There's nothing that you can do. There's no amount of testosterone that you can take that's going to bring it back.
Okay.
Okay, that's why I said you lose muscle mass, but you don't lose strength. That's something that just automatically happens with the changes that our body goes through. Women go through menopause, men go through andropause. And as you go through that, it is a cycle that there's no amount of hormone that a doctor can give a woman when she's postmenopausal that can reverse that. It is what it is. It's done. It's finite. It's over. Men is the same thing. So at the end of the day, it helps you to feel better. It may help you to perform a little bit better. But you're not going to look like you looked when you were 30.
Really?
Really. Any other questions? Well, it was my pleasure to present to you. I pray that the information that was shared has been helpful and has been maybe a blessing to you, and hopefully you've learned something that you might not have known. And I wish you all well. God bless you. Oh yes, absolutely.
You mentioned the Kegel exercise.
Yes, Kegel exercise.
Yes, strengthen the blood. But what about men?
I'm sorry, men can't Kegel.
I understand that.
I'm sorry. I don't know. No, I actually don't know of anything that actually helps to strengthen the bladder in men. No, no, they didn't come up with that. We had a little edge there. I'm sorry. And if it exists, I'm unaware of it. Okay. All right. Thank you very much.
Great job.
I hope this session was informative. The knowledge that you received is there to put the question in your mind, what are you going to do with it? We have given it to you, and you have a choice to keep it or to share it, to use it or to keep it. It is up to you. We would hope that you would use it and keep it. And we can encourage each other with the knowledge that we receive. I want to close out now, and I will actually put this young man on the spot. Dr. Catwell, would you close out a prayer for us? Remembering that we will be here this evening at 6 o'clock and on again with the global impact on singles, on fathers, and singles. That topic, those two topics were extremely hot last night. The Spirit moved and we went way over time like today. So we will allow the Spirit to move again. All right? Dr. Kaplan.
Father, we bless you for these occasions, which we can refresh our knowledge, refresh ourselves with interesting information. For that, we will profit largely from this information. We will go out and practice the things that are necessary. We will be better stewards for you and your service because of what we've heard, because of what we've learned. Bless our teachers who have helped us, who have been so dear to us and given us this profitable knowledge. Bless our session tonight. Bless all those who are coming. And grant that it will be great food for thought. And above all things, grant that we would be better able to serve you in our lives, in our service, in our witness. To you be glory now, honor and praise for all your help, all your blessings. Our session here, in Jesus' name, amen.